Hello everyone, welcome to Jessie's MedBio. In today's section, I am going to explain about our third chapter, that is nursing care of neonate. Under that, our first topic is appraisal of newborn. Appraisal of newborn means it is the newborn assessment. So, newborn assessment means it is a type of assessment or an examination of a newborn baby, and when we are doing the assessment means immediately after the birth and also during the first few days of life. For what purpose we are doing the newborn assessment means to detect or identify any abnormalities and to assess the adaptation to extrauterine life and also to plan the appropriate care. For these three purposes we are doing the newborn assessment. Here the newborn assessment are classified into three, that is immediate assessment. Immediate assessment means the assessment done immediately after the birth. Then next one is the transitional assessment. Transitional assessment is also known as period of reactivity. This is the assessment which is done during the first 24 hours. Then last one is periodic assessment. This assessment we have to done daily until the time of discharge. So these are the main three types of newborn assessment, that is immediate, transitional and periodic. So the first one is immediate assessment of newborn. Under the immediate assessment of newborn, the first one is the Apgar score. Apgar score means we are assessing the newborn at the 1 minute and at the 5 minute after the birth. So the criteria which is coming under the Apgar score is A means appearance, which refers to the skin color, and according to the skin color we are determining the oxygen or oxygenation level in the newborn baby. Then P means pulse, that is heart rate. It reflects the circulatory function of the newborn baby. Then G means grimace, which shows the neurological response of the baby. And A means activity, which refers the muscle tone of the baby. And last one is R, that is respiration, which refers to the respiratory effort of the baby. So here they classify the score into 0, 1, 2. According to this score, we have to interpret the condition. If the score is coming in between 7 to 10, which means the newborn baby is normal only. Then if it is coming in between 4 to 6, which means the moderate depression is present, the baby needs the observation and proper assistance. And if it is coming in between 0 to 3, which shows there is severe depression is present, so the baby needs the immediate resuscitation. That is about the Apgar score. And under each score, which means under 0, under 1 and under 2, the descriptions are there that you can read. So these about the Apgar score. Then next one is birth weight. So an average weight of a newborn baby is 2.5 to 3.5 kg. Then umbilical cord. So for a normal cord there will be 2 arteries and 1 vein is present. That we have to check, and also we have to check for any bleeding, infection or abnormalities in the umbilical cord. Then fourth one is orifices. That means we have to check all the body openings. So first one is the mouth. We have to check the mouth for cleft lip or cleft palate. Then nose, we have to make sure that patent nostrils are present. Then for ears, we have to make sure that both the ears are in normal shape and it is in normal position. Then anus, we have to check whether the anus is patent or not. Then for urethra, for the male we have to check for the hypospadiasis and epispadiasis. And also we have to check the back of the newborn baby for any type of lesions or the presence of spina bifida. These all things we have to check. That is about the first assessment, that is immediate assessment. So the second one is transitional assessment, which is also known as period of reactivity. This is the type of assessment we are doing during the first 24 hours after the birth. So we are assessing that whether the newborn babies adjust to the extrauterine life. Here the period of reactivity is divided into two, that is first period of reactivity and then second period of reactivity. So first period of reactivity means which occurs from the first 30 minutes to 6 to 8 hours after the birth. During this time the baby is very active, alert and start to cry, and strong sucking will be there, and it is the good time to give breastfeeding to the baby, and also there will be good eye contact. And what all are the assessment we are doing this period are, we have to do the general examination of the baby, and also we have to assess the anthropometric measurement and head to toe examination, neurological examination, and reflexes we have to check, and also we have to assess the gestational age. That is about the first period of reactivity. Then coming to the second period of reactivity means which occurs about 6 to 8 hours after the birth, which means it starts after the first period of reactivity and it lasts to 2 to 5 hours. And during this time the baby will awake again, and the baby will active, and their heart rate will slightly increases. Also their respiratory rate will increases, their gastric secretions will be increases. After this the baby will enter into a stabilized state. That is about the transitional assessment or period of reactivity. Then coming to the third assessment, that is the general examination, which is coming under the periodic examination. So what all are the things we have to check under the general examination are, first one is the posture. For the posture, if it is a tame baby, the posture will be flexed. So if it is a preterm baby, the posture will be frog-like structure. Then coming to the activity, the normal baby will alert and active. If any lethargy or if any weakness is present, which indicates the presence of illness. Then coming to the cry, for a normal baby, the cry will be loud and strong, and if weak cry is present means the baby is a premature baby or the baby is having low birth weight. Then if the baby is having high pitched cry means there will be chances of increased intracranial pressure, and also there will be the chances of presence of some neurological problems. Then coming to the color, for a normal baby the entire body will be pink. For an abnormal baby the cyanosis will be present. The cyanosis will be present due to any type of heart or lung diseases, and if the baby is pale means there will be the chances of presence of anemia. And if jaundice is present, which means the yellowish discoloration will be present in the sclera or in the nails and all, there will be the presence of hyperbilirubinemia. That is about the color. Then coming to the vital signs, for a normal baby the temperature will be 36.5 to 37.5 degrees Celsius. The heart rate will be 120 to 140 beats per minute. Respiratory rate will be 40 to 60 breath per minute. That is about the vital signs. Then coming to the anthropometric assessment. Under the anthropometric assessment, the first one is weight. For a normal baby, the weight should be in between 2.5 to 3.5 kilogram. And during the first week, the baby will loses the weight about 10%, and the baby will regains their weight by 10 to 14 days. And when coming to the length, for a normal baby, the length should be in between 45 to 50 centimeter. Then coming to the head circumference, for a normal baby, the head circumference will be in between 33 to 35 centimeter. If the large head is present means hydrocephalus is there. If the small head is present means microcephaly is there. When coming to the chest circumference, for a normal baby, the chest circumference is from 31 to 33 centimeter, and usually or for a normal baby the chest circumference will be 2 to 3 centimeter less than the head circumference of the baby. Then coming to the head to toe examination. Under that, first one is skin. For a normal baby, the skin will be very soft and smooth, and also it will be covered with vernix caseosa. Vernix caseosa means it is a white cheesy like substances which is present all over the body of the baby. Then we have to observe for the pallor or cyanosis, jaundice, and also for the skin turgidity. Then coming to the head, for a normal baby, the skull bones are not fused, and also the sutures can movable, and the fontanelles are present. And for the suture, we have to allow the skull for molding during the birth time. And if wide separation is present, which means there is increased intracranial pressure or hydrocephalus is present. And if premature fusion is happened to the suture means there is the chances of occurrences of craniosynostosis. Then coming to the fontanelle, we already know that two types of fontanelles are there, that is anterior and posterior. Anterior fontanelle is diamond shape and its size is from 2.5 to 4 cm, and it's usually closes during the time of 12 to 18 months. Then posterior fontanelle means it is in triangular shape. It usually closes during 6 to 8 weeks. And if the fontanelle is bulged means there is increased intracranial pressure and also meningitis will be there. If the fontanelle is sunken means there will be the chances of presence of what? Dehydration. That is about the fontanelles. Then coming to the scalp, we have to check for the caput succedaneum and cephalohematoma. For these two conditions we have to assess. Caput succedaneum means there will be edema of the scalp is present, and it usually disappears within 2 to 3 days after the birth. And then cephalohematoma means there will be bleeding present in behind the side of periosteum. That is, the blood collection will be there. It may take few weeks to get resolved. That is about the scalp. Then coming to the face, we have to check for the symmetry or any type of birth injuries are there, and also we have to check for the facial palsy. Then coming to the eyes, we have to check for the position of eye, whether the red reflex is present or not, whether any hemorrhage is present or discharge is there or not, that we have to check in the eye. Then coming to the ears, we have to check for the shape, position, and also for the cartilage. And if the ears are low set means the baby is having the Down syndrome. Then coming to the nose, we have to check whether the nostrils are patent and whether nasal flaring is present or not. If the nasal flaring is present means the baby is having the respiratory diseases. Then coming to the mouth, I already explained what all are the things we have to check in the mouth, which means we have to check for cleft lip or cleft palate, and we have to check for the oral thrush. It is an infection which is caused by the Candida albicans. Then we have to check for epistine pearls, which means there is a small white cyst on the palate and it will be disappear spontaneously after the birth itself. Then coming for the neck, we have to check for any type of swelling or webbing is present. Webbing means a skin fold which is present on both sides of the neck. Then we have to assess whether the lymph nodes are enlarged or not. Then coming to the chest, for a normal baby, the chest will be barrel shaped and equal movement will be present. And sometimes the breast enlargement will be there. And also sometimes the witch's milk will be present in the nipple area for the female babies. It is due to the maternal hormones. And when coming to the abdomen, normally it is soft and the umbilical cord is present with 2 arteries and 1 vein, and bowel sound is present. And in the abdomen we have to check for the hernia, the organ enlargement. Then coming to the hands and feet, we have to check for syndactyly and polydactyly, which means the extra number of fingers will be present, that we have to check. And also we have to check for the single transverse palmar crease. if it is present, which indicates the baby is having Down syndrome. Then coming to the genitalia of female, we have to check whether the labia majora covering the labia minora. Then if white discharge is there, it is normal only. Sometimes pseudo menstruation will be occur in female because of the maternal hormones. Then coming to the males, we have to check whether the testis is descended or not, whether the urethral opening is normal or not, or we have to check for the hypospadiasis and epispadiasis. Then coming to the back and spine, we have to check for the spina bifida, or any dimple formation is there or not, then any hair formation is there, or any presence of masses is there, that we have to check. Then for the neurological assessment, we have to assess the muscle tone, the mobility of the joint, then all the type of primitive reflexes we have to check, and also we have to check the body movements of the baby. Then coming to the gestational age assessment means we are using New Ballard score. It is the name of the scale or the score which we are using to estimate the gestational age. This score we are using for the babies between 20 to 44 weeks of gestation to identify the gestational age. Then the accuracy will be plus or minus 2 weeks. And here under the gestational age, we are assessing the physical maturity and the neuromuscular maturity of the baby. This is all about the gestational age assessment. So these are the assessment, or these are the appraisal of a newborn after the birth. 3 assessment we studied. First one is the immediate assessment after the birth. Then we studied about the transitional assessment, that is the period of reactivity. And last we studied about the periodic assessment.